Have you ever tried to pick up your cup of tea or open a jar, only to feel your fingers suddenly catch or lock in place? Maybe you had to use your other hand to straighten them out, or you waited a moment and gently coaxed your fingers to move again. It can feel startling, almost like a small betrayal from the hands you've trusted all your life. If you've noticed this kind of locking or stiffness in your fingers, you may be dealing with a hidden tendon issue, something that many older adults experience but often dismiss as mere arthritis or just part of getting older. Why does this matter? Imagine for a moment losing the ability to do simple everyday tasks, like holding a grandchild's hand firmly, writing a birthday card with confidence, or comfortably enjoying a hobby that requires fine motor skills, such as painting or playing cards. Finger dexterity isn't just about physical movement. It's about maintaining independence and the joys of daily life. Many seniors find themselves making silent adjustments when these symptoms creep in. They might think, I'll just live with it, or I'll get it looked at eventually. But waiting too long can allow these hidden tendon problems to worsen, gradually limiting your ability to manage tasks you once performed effortlessly. Here's the intriguing part. By addressing these hidden tendon issues early, you can often maintain or even restore much of your hand function. For some, that's a lifesaver when it comes to cooking, gardening, or simply buttoning a shirt. For others, it can be the difference between feeling secure in daily routines and frequently worrying about dropping dishes or struggling with zippers. Maintaining healthy, flexible hands can help preserve your sense of autonomy and keep you doing what you love. Whether that's crocheting gifts for loved ones, tending to a cherished rose garden, or confidently signing your own checks. In a moment, we're going to delve into 3 vital insights about finger lockups and what they reveal about tendon health in seniors. We'll approach it like detectives, following the clues and separating myth from reality. You'll learn why these lockups happen, how to spot the most common misconceptions that stop people from getting proper help, and simple yet powerful strategies that can strengthen your hands in ways that might surprise you. Think of it as a small investigation, one that could make a major difference in your day-to-day life. I've spent years talking with seniors, caregivers, and professionals who focus on hand health, gathering knowledge about what really works over time. While I'm not here to diagnose or offer medical treatment, I can share valuable patterns and practical recommendations that have made a real impact for many older adults. If you've ever felt frustrated by fingers that just won't cooperate, or if you pushed aside the warning signs because you assumed it was inevitable, let's uncover the facts and explore hopeful solutions together. Before we get started on our first clue, I'd love for you to think about what having stronger, more flexible hands would do for you personally. Maybe it's regaining the ability to sign your name with ease, or confidently picking up your grandchild without any fear of your fingers giving way. Keep that vision in your mind. At the end of our time together, you may find yourself equipped with new techniques that could transform your day-to-day life more than you expect. Ready to do a little detective work? Let's investigate the hidden messages your fingers may be sending and how to respond before problems grow larger. We begin our detective journey by challenging one of the biggest assumptions about finger lockups, that they're just a normal part of aging and there's nothing you can do about them. In reality, these lockups can be an early warning sign of something deeper going on with your tendons. Understanding this is our first step. Many seniors believe that finger stiffness or catching is primarily caused by joints wearing down. It's easy to assume it's all about your bones, especially if you've heard terms like bone on bone from friends or family. Let's look at Esther, who's 72 and has always been proud of her self-sufficient lifestyle. She lived on a farm for decades, milking cows in the early hours and tending her vegetable garden in the afternoon. In her mid-60s, Esther started noticing that her ring finger would catch whenever she tried to open jars or make a fist. At first, she assumed it was simply a sign of overwork or arthritis. Months went by, and her finger actually began to lock more frequently, sometimes with mild pain. Even more worrisome, it occasionally stayed bent, forcing her to manually pop it straight again. What Esther initially chalked up to aging joints turned out to be trigger finger, a condition involving the tendons and their protective sheaths. Essentially, the tendons that help bend and straighten your fingers can get inflamed or develop nodules, leading to that distinctive catching or locking feeling. When the sheath around the tendon narrows or the tendon itself becomes irritated, it's like having a rope move through a narrowed channel. It snags, and you feel that snap. Although it's not uncommon, it's also not something you should ignore. Many people who develop trigger finger or similar tendon issues can experience worsening symptoms if left untreated. So what's the real scoop? While bone and joint health are incredibly important, your tendons, those fibrous cords connecting muscle to bone, also play a critical role in the movement of your fingers. These tendons work seamlessly most of the time, allowing you to perform the small tasks that make up your daily life, from picking up a fork to buttoning a shirt. But if the tendon sheath is tight or inflamed, even small motions can become a struggle. This is where that hidden tendon problem manifests. The good news is that once you recognize the sign, fingers catching or locking, you can take steps to reduce inflammation and lessen discomfort. Some seniors benefit from gentle finger stretching or warming up their hands with a warm towel before engaging in any activity that places stress on the fingers, such as gardening or knitting. Others find that limiting repetitive, high-stress motions, like long sessions of gripping or carrying heavy bags, gives their tendons a chance to recover. There are also simple splints or finger braces available, designed to keep the tendon aligned and reduce strain. Addressing tendon health can have a profoundly positive impact on your day-to-day comfort. Not only might you experience less finger stiffness, but you'll also likely find you have more confidence doing tasks that were becoming challenging or painful. Esther, for example, began using a gentle stretching routine every morning and wore a finger splint at night for a few weeks to prevent her finger from curling up during sleep. Within a month, she noticed significantly less locking and was able to open jars without that worrisome catch. Think about your own daily activities. If you're experiencing any catching or locking, take a moment after our discussion to move your fingers gently and see if you notice tightness in particular spots. That little check-in can provide an early clue about the state of your tendons. Don't just assume it's unchangeable. Recognizing you may have a treatable tendon issue is the first vital step toward relief. Now let's move to our second clue on this detective mission. Discovering why so many seniors downplay finger lockups and underestimate how significantly it can impact their lives. There's a common misconception floating around that goes something like this. If I have a little locking or pain, I should just ignore it until it becomes really severe. After all, doctors can't do much anyway. This misconception often holds people back from exploring the full range of strategies that could help them. Consider Bill, a 75-year-old retiree who spent most of his working years as a carpenter. He's no stranger to aches and pains in his hands. When he started experiencing a catching sensation in his middle finger, he shrugged it off. It's just part of the wear and tear, he told himself. For a while, Bill's hand continued to serve him well enough for everyday tasks. Then quite suddenly, it became excruciating to grip his morning coffee mug. He felt a sharp click followed by an uncomfortable pull when he tried to extend his finger fully. That's when he realized ignoring the problem didn't make it go away. In fact, it made things worse. Why does this happen? One reason is that problems involving tendons, nerves, and soft tissues can quietly escalate. Mild inflammation that causes your finger to catch occasionally can morph into more serious issues, where you're dealing with full-blown pain or even a total lock that might require a procedure to correct. Tendon health, like many aspects of senior wellness, is best preserved when you address minor signals before they become major red flags. There's a secondary cost to ignoring tendon issues. It starts to limit your sense of independence. You might begin avoiding tasks like carrying groceries, firmly shaking hands, or simply opening doorknobs if you fear your grip will fail. Over time, this can chip away at confidence. Bill found himself turning down woodworking projects he once enjoyed, all because he feared his locked-up finger would cause him to drop tools or make a mistake on a cut. So what can you do if you're in Bill's position? First, pay attention to your pain or any form of repetitive strain. If you love activities that require sustained gripping, woodworking, knitting, gardening, remember to take breaks. Set a timer for every 20 or 30 minutes, and when it goes off, gently stretch your fingers, rotate your wrists, and flex your palms to improve circulation. Use warm compresses to soothe tendons and reduce stiffness. If you notice persistent catching, consider talking to a healthcare professional about conservative treatments like splinting, anti-inflammatory approaches, or specialized exercises. Emotionally, being proactive can provide an enormous sense of relief. Knowing you're taking steps to address the problem often reduces the anxiety that comes with wondering, is my hand function going to decline? Or am I going to lose the ability to do what I love? By facing the issue head-on, you maintain agency over your health. It's a form of self-advocacy, which becomes even more vital as we age. Let's pause and do a quick self-check. Is there a task you've started avoiding because your hands don't feel as reliable as they once did? Maybe you're worried about dropping a plate or feeling pain from gripping a pen too long. If you can identify one activity like that, ask yourself, could I modify my approach or give my fingers some attention that would keep me engaged in this activity? Often, a small adjustment, like using a jar opener with larger handles or taking more frequent breaks, can keep your tendons happy. You might be surprised at how small tweaks can keep you going strong. Now that we've looked into the dangers of ignoring tendon lockups, let's examine our final clue. The practical steps to protect and improve finger dexterity, especially if you've noticed that telling catch or lock. There's an assumption floating around that once your fingers lock up, you have no choice but to rely on interventions like surgery or medical injections. While those options can be helpful in some cases, they're not the only avenues. In fact, you can often make significant headway with a combination of gentle mobility exercises, mindful daily habits, and supportive tools. Let's explore a more balanced approach. Meet Joan, 68, who loves to sew. She noticed her pinky and ring fingers sometimes locked after long sessions working on quilts for her grandchildren. Worried about losing her hobby, she decided to be proactive. Rather than jumping to drastic measures, she first tried a series of gentle exercises recommended by a professional hand therapist she found through her local senior center. Every morning, Joan would soak her hands in comfortably warm water for a few minutes, then perform slow, deliberate finger curls and extensions, kind of like making a slow fist, then opening her hand wide. This helped reduce stiffness and got her tendons moving more freely. Next, she began pacing herself during sewing sessions. Instead of quilting for 2 hours straight, she set a timer for 30 minutes. When it rang, she'd pause, rotate her wrists, wiggle her fingers, and take a few deep breaths. Sometimes she'd just place a warm compress around her hand to relax the muscles and tendons. By the time she went back to work, her fingers felt looser and less prone to locking. Over a couple of months, she found that her fingers locked less and that her hand felt stronger overall. If she did experience the catching sensation, it was milder and less frequent. The evidence behind these simple strategies lies in how tendons and the surrounding tissues respond to gentle, consistent movement. By encouraging better blood flow and reducing repetitive strain, you help maintain the health of the tendon sheath. Many healthcare professionals who specialize in senior wellness suggest adding low-impact hand stretches to your daily routine, especially if you engage in hobbies or tasks that involve repetitive motions. For extra support, consider compression gloves designed for hand comfort. Some seniors find these very helpful during activities requiring a steady grip. Beyond physical improvements, there's a real sense of empowerment in realizing you have tools to manage and even prevent your fingers from locking up. You gain the freedom to continue cherished hobbies and daily tasks, which can boost emotional well-being. Feeling in control of your hand health might also inspire you to look at other areas where small interventions can make a big difference, like doing brief stretching sessions for your shoulders, hips, or lower back. If your lockups are frequent or painful, it's wise to consult a healthcare professional who understands tendon and joint concerns in older adults. A short-term splint or focused exercises might be all you need. Keep in mind that medical interventions like steroid injections or surgical procedures do exist for more severe cases, and they can be highly effective. But those interventions typically don't replace the importance of ongoing tendon care. After any procedure, you'd likely still be advised to practice gentle stretches and mindful activities to sustain your improvements. Now let's do a quick reflection. Think about a routine that involves your hands: baking, writing in a journal, even playing a card game on Friday nights. Could you incorporate a brief warm-up for your fingers before you start? Maybe a minute or two of stretching, or simply rubbing your hands together to generate warmth and improve circulation? These small changes can mean the difference between ending the day with stiff, sore fingers and feeling good about how you spent your time. We've followed the clues from identifying the hidden tendon issues behind finger lockups, to realizing how dangerous it can be to ignore them, to exploring practical solutions that don't always require drastic medical procedures. Let's tie everything together and see how you can put this knowledge into action. When you step back and look at the picture we've painted, it's clear that finger lockups often indicate more than just old bones. They reveal potential tendon problems that can worsen if left unchecked. But the hopeful news is that awareness, early intervention, and consistent self-care can dramatically reduce discomfort and protect your day-to-day independence. Whether you're like Esther, who discovered trigger finger was at the root of her problem, like Bill, who realized his approach of ignoring the symptoms was making them worse, or like Joan, who found relief through gentle exercises, each story illustrates the potential pitfalls of underestimating these issues and the real possibilities that come from taking them seriously. It's important to act sooner rather than later. Doing so isn't about succumbing to fear. It's about being proactive and preserving function while you still have the ability to make positive changes. By treating hand and tendon health with the attention it deserves, you can help ensure you'll be able to handle tasks, maintain hobbies, and keep the confidence that comes from knowing your hands will cooperate when you need them most. If you're curious about where to begin, start small. Warm up your fingers in the morning, use a gentle stretch, and pay attention to any catching or pain that feels unusual. If you sense that something's not quite right, consider seeking professional guidance. For some people, a single visit with a hand specialist or occupational therapist can set you on the right track. If you're not experiencing any symptoms yet, these preventive measures can still strengthen your tendons and protect you against future issues. For those who are ready to go a step further, invest in supportive tools like ergonomic jar openers or padded gloves for yard work. Take short breaks whenever you engage in repetitive tasks. Your tendons will thank you. If you find yourself dealing with persistent pain or more frequent locking, it might be time to explore specific exercises, splints, or other interventions under professional supervision. The important thing is that you know there are options. You're not stuck waiting for the problem to become bad enough. I encourage you to share what you've learned with friends, neighbors, or family members who might also be dealing with these hidden tendon issues. There's a good chance you know at least one other person who's been silently worrying about their locking fingers. By opening up this conversation, you can create a support network that helps everyone find solutions faster. If you'd like to keep the momentum going, consider commenting on this video with any questions or experiences you have about finger lockups or hand health in general. You can also hit the subscribe or follow button to stay connected with more guidance on senior wellness. Even better, if you feel this information could benefit someone in your life, maybe a sibling or a friend who's been struggling, feel free to share it with them. Each small action adds up to a broader community of seniors who are informed, empowered, and ready to take control of their tendon and joint health. Remember, your hands have carried you through a lifetime of experiences, cooking meals, creating memories, and expressing love through every hug or handshake. They deserve care and attention now, perhaps more than ever. By acknowledging the early signs of tendon trouble and taking proactive measures, you can give yourself a better chance of continuing to do the things that bring you joy. Rather than seeing these lockups as a sign of inevitable decline, view them as your body's way of sending a message. It's time to take action. Trust that you have the power to shape your own health journey. With knowledge, small daily habits, and, when necessary, professional insights, you can protect your independence and keep your fingers agile for the long run. Your life story is still unfolding, and your hands play a central role in the pages yet to be written. So, here's to you taking that next step toward healthier tendons and more freedom in everyday life, starting right now.